Lack of effective leadership is at the core of challenges facing Kapanya Hospital in Mojaji Scruff. Limpopo Health MEC Poppy Ramathuba paid a surprise visit to this hospital this morning after receiving numerous complaints of poor service from members of the public on her Facebook page. Well, the MEC joins us in studio this afternoon. Good afternoon, MEC, and thank you for your time on the SABC News Desk.
Afternoon, Keshin, and afternoon to all your viewers.
MEC, social media has really exploded with these images distressing coming out of Mojaji Scruff. Elderly woman spending the night on benches in a wheelchair. And this is not an isolated case, MEC. It's not the first time this particular hospital has grabbed headlines for poor service delivery. What did you actually see when you got there?
Yeah, of course, the challenges were confirmed by the number of patients that we found in the outpatients. While yes, we do have infrastructure challenges which they are not of their own making, it's something that is a provincial government. We've got to deal with the backlog of the infrastructure, but there are other areas which I was just worried that this is pure leadership. You see, when a patient open the file, you find a lady called Bridget, very smart. I wish I could duplicate her. She's got time frame. She will tell you, I'm goal orientated. When a patient comes, by 10 o'clock, all the patients should have received the file. Indeed, I found there were no patients waiting for the files. But when we go where patients are supposed to be taken, the vitals, to be triaged by nurses, that's where the challenge started. So that's when you start to see that in terms of nursing services, we need to make intervention. When you also look at patients waiting for the doctor to be seen by the doctor, they wait for a very long time.
I mean, so one patient in particular complained of waiting 6 to 8 hours, and that's simply unacceptable.
That's really unacceptable. You can't have a facility with 17 doctors, but they are failing to clear the... We have got hospitals that have got far much less doctors than 17, but they are able to deal with that. And of course, while we appreciate the challenge that some of our patients do not want to go to the clinics, that's another area that it's also showing that why wouldn't patients want to go to the clinic? Because when they go to the clinic, they are told that there's no medicine. My late grandmother used to tell me, in your clinics you only find Panado, and the fact of the matter is not every condition which is treated by Panado. So the reality is that why would the pharmaceutical depot in the province have pharmaceutical stock, but the stock not reaching the clinic? So it tells you that there is a challenge in terms of the leadership and management on that area. So that's why we have to make those particular interventions.
All right, I understand that you want to set up an interim management team. When will that roll out, and can you attach some timeframes for us?
You see, immediately after receiving the complaint on my wall, I started to do my own investigation without the hospital even knowing and even being aware that I'm doing that. And because
but are you sure the hospital was not aware of your visit?
Today they were aware.
Because some patients, they were aware. So it wasn't actually a surprise, MEC.
On Tuesday, when I received the complaint, they were not aware as to I've sent a team that went to investigate and pick up the challenges. That is where last night, when I got the report yesterday, last night we didn't sleep trying to find out who can. And we made the intervention. It's not about we are planning to make intervention. When I went there today, because already executive management knows, these people tell each other that she has left in her itinerary, she's going to Japan. I knew they would know exactly. That is why the investigation, I did not do it today. It was done before. Today, it was just a confirmation. You see, even if people want to hide things, there are things that you can't hide on one day. If your staff is used to be working in that, you will still continue to find the same. So today, when we went there, we already had a team, because last night we did assemble a team. I've given that team, we have got a lady who would be the acting CEO for 100 days. Another lady would be acting nurse manager for 100 days, and one doctor there would be an acting clinical manager for 100 days. But in terms of the finance manager, we have appointed, we transfer also a finance manager from the district, because that's where the challenge is. In terms of buying cleaning materials, you find a lot of delay because supply chain processes there are a serious headache. So we had already got somebody. And then we have got Dr. Maringo, who is there, the family physician, who will be providing skills and assisting the clinic. So when we went there, we were introducing that particular team. It has started today. I've given them 100 days. Within 100 days, I'm expecting those quick win We categorize our problems to the quick win, the short term, the medium term, the one that warrants them as management, the one that warrants the district. I was with the district leadership there, the ones that warrants the province. Within 100 days, I'm expecting the hospital to be different. In terms of the patient flooding the hospital, we have now, Devil's Kloof has got a health center which is underutilized. We are going to be taking one doctor to that health center, and we are decanting patients from maternity who are coming for antenatal there because it's overcrowded. We are taking them to Devil's Kloof where they will be seeing a doctor and we'll be putting a pharmacist assistant. So we when we go there today, we already had plans. We don't want, I don't want a situation.
So you're not just paying lip service, you have a concrete plan of action?
I don't like that because it's about the lives of people. Is it the problem?
And what happens to the current management in place at the hospital right now? How are you going to deal with it?
You see, when you look at them, I had a one-on-one with some of them. I've told them where, you see the challenge that we do as a Department of Health. You find that Popira Matuba is a good clinician. But now, because he's a good clinician, you make her a CEO of a hospital. She became a worse CEO. So there are those who are very good nurses. Let's not frustrate them and destroy them by giving positions which they are not good at. So we are not throwing away anybody. We are putting them where we feel their strengths are. Everyone has got a strength. There's no person who doesn't have a strength. Unfortunately, we put people where in their weakest. When we introduced the OSD, we were saying we don't want clinicians to leave the patient and go and become managers. So what we did today was to take people to where their strengths are. And that's what we are doing along. By the way, it's not the first hospital. We've done it in Malamlel, and we're no longer receiving those complaints in Malamlel. We were busy doing it in Litab. So we'll do it across the province.
Limpopo Health MEC Poppy Ramatuba joining us on the SABC News Desk this afternoon. Thank you for sharing your insights with us. Well, and all